inviting me. And thanks to Nate and his crew for organizing this. This is one of the most important things that we as citizens can do to influence anything politically, but specifically to influence healthcare reform. And I really want to emphasize that in terms of the context of the healthcare reform discussion that's happening right now, I don't think the timing of this meeting could be any better. Congressmen are literally sitting down in their offices and writing the bill as we speak. And this is a vital time for us to really voice our concerns on a very specific level on what kind of detailed policy changes we want to see in healthcare reform that's introduced later this summer. Second thing, I just want to personally acknowledge Linda Farley. I really believe that I wouldn't be standing here if it wasn't for her as a prominent example in the community for healthcare reform. She is a model physician. She's a model human being. And I just think that she should be recognized for many years to come. So just to give you a little bit of perspective of where I'm coming from, I graduated from family medicine residency at the UW, St. Mary's Hospital. I've been practicing in Iowa County since 2005. I do work for a health system. I work for a regional clinic associated with the Dean system. So I have had some experience in a for-profit medical clinic setting. I am also the medical director of the Community Connections Free Clinic, which opened in Dodgeville in 2006. So I'm also seeing how, as you well know, this healthcare system is failing a lot of people and in a lot of different ways. And that's what prompted me to feel obligated to research on how we can change this issue and how I can play some part in the reform movement. Now, I said briefly this is a really critical time, and I'd like to say this is the perfect time for a single-payer system, but I want to start by creating a context of where single-payer system is right now in the negotiations, what Congress is talking about right now, specifically with this public plan option that Obama wants to introduce to his plan. And I want to talk about how everyone is thinking about these things as we're moving forward. I think this is a very good time for single payer in a lot of ways. First of all, we have a president who is committed to health care reform. We haven't seen that in quite some time. We also have an escalating healthcare crisis, which arguably is a prime moment to seize for reform. And thirdly, one of the advantages of an unfortunate recession can be public outcry for economic reform and specifically healthcare reform. And I think using reform as a reason to get us out of this recession and to get us into recovery is a convincing argument in these times. However, I'm concerned because I think that I think it's debatable of whether single-payer system is at the mainstream of the public's demand for healthcare reform, and we need to do something to change that after this evening. But I just want to give you, I'm sure you guys know the reality of single-payer is finally starting to get into the mainstream media. It's finally getting discussed, and people in Congress are finally starting to hear the noise that everyone is making. I think that's a good thing. Some things that may be working against that is the economy is starting to turn around. And I think that if people say that, as things are starting to improve, that people can make an argument that we don't need to have major healthcare reform. I think that the healthcare system is on the way to collapse, but it has not yet collapsed. And some would argue that it's when we get that collapsing point that we'll be able to revamp it into a single-payer system. And the last thing that we're seeing is that the healthcare industry is really flexing their muscles right now. We know that they have a very strong lobby, and this is something that we're going to have to fight for the weeks and months to come in order to get single-payer's plan passed.